very good morning to all my dear students. So today we will talk about our third vitamin, that is vitamin B3, also called as niacin. So what is this niacin? We will be discussing about this niacin under these following headings. I always like to talk about the history because it just shows that the mere triple vitamin or the triple vitamin disease that we are studying actually goes back long in the history, showing that once upon a time it created a havoc and chaos. Sometimes it gives a hope whenever we see a crisis situation like we are seeing right now, the pandemic crisis situation, that even this phase will pass too. And also, it gives importance to the nutritious substances in the food that are prime most important to avoid such diseases. Only 1700s and nearly about for 2 centuries, whole world was actually boggled with one of the epidemics which bothered especially Italy and Spain. Now here the people were dying because of a typical disease which had a very typical presentation. The people came with complaints of dermatitis, had diarrhea, had dementia, forgetfulness, were not able to document or register any recent memory, and ultimately, when not treated, they were bedridden and they would die. So, a lot of speculation and quite a few theories came up. There are certain myths also related to this disease, which is very fascinating actually. Finally, they call this disease as Legra. What does it show? Does it remind you of something? Vampires, right? Strange thing about the disease was that in early 1700s, this disease was thought to be a vampire disease, a cursed disease. And the reason for this was because patients who were suffering from pellagra had dermatitis. And this dermatitis was caused when the patient was exposed to sunlight. Doesn't it sound similar? When the vampires are sensitive to sunlight and their skin burns. They could see that even the pilgrims or the patients who were suffering from pellagra, they would avoid sunlight in order to maintain their strength. And similar thing was seen in the vampires. So the theory was very famous during back in days of 1700 that they were bitten by vampires, or it was they were vampires. They were vampires. Finally, it was called Legra because Pele means rough skin. Pele agra means rough skin in Italian. And this was first proposed by Italian physicist Frappoli. Uh, and mainly it looked upon the dermatologic manifestation, which was the first starting. What theories came up during the whole world was trying to solve this mystery of Allegra? Some people said that it was because of blood-sucking insect. Some said that retention of certain mineral salts. Some said that because of ingestion of certain semi-dried edible oils. And even the disease was related to leprosy because even leprosy is a dermatologic manifestation, has a dermatologic manifestation. Later, Lombroso's theory of maize-related started picking up. They say that there was some connection between maize eating population, maize export, and the pellagra. So what they still didn't know what exactly how maize and this disease was related. Lombroso thought that maybe there is some toxin in maize, in deteriorating maize, which when consumed will cause this. Or some said that it could be inadequately dried and stored maize under the influence of microorganisms. They didn't know what exactly was it. They somehow knew for sure that it was something to do with maize. And today we agree to it that yes, maize plays some role in development of Allegra. In 1914, Person by name Joseph D. Goldberg confirmed Legra as nutritional deficiency disease. He said it is not because of contagious, it is not a contagious disease like leprosy or any other thing. It is not spread by insects, it is not spread by sharing food. He even went into doing his experiment by filth parties, apparently, but nobody believed him. Okay, and he started saying that the only way to manage and cure this disease was to give a good dietary supplementation, and he started doing this manipulation in institutionalized humans. Goldberger named the causative deficient factor as Legra preventive factor. Later on, Spanish physician Gasper, he started documenting all the Legra and its features also. Ultimately, in 1937, finally, a biochemist again, named Cossin, finally isolated the molecule whose absence was actually responsible for causing pellagra. And now we know that it is nothing but niacin or vitamin B3. By the time people called it as vitamin D also, just to honor Joseph Goldberger. Some even still call it as Goldberger's factor as well. Sadly, Goldberger did not live enough to see the discovery of the vitamin. He developed kidney cancer and died in 1929 at the age of 54. And for quite some time, his wife had to struggle convincing people that no, he didn't contract niacin and die, because all the while he was busy showing that it was a non-contagious disease. But history prevails. Finally, we have our vitamin. Thank you.